Hello, this is Dr. Bob DeMaria, and thank you for joining us once again on another episode of Doctor to Doctor. And today, we're going to talk about the #1 killer in our society today, and that happens to be heart disease. Now, we're going to talk about some very simple physiology because I don't know if anybody has totally figured out heart disease itself, but I want to give you some insight of what I have learned practicing since 1978. It's inflammation. Inflammation is fire that's occurring inside of your body. You see, so many people are concerned about their cholesterol level, and I would be concerned too, but I'm going to give you a couple reasons why. Cholesterol is not good. Cholesterol is not bad. Cholesterol is necessary. Cholesterol is very beneficial. I want you to think of cholesterol as a fireman putting out a fire. I'm going to share some interesting thoughts with you right now. We're going to stretch your brain a little bit. Cholesterol firemen in your body cannot float in blood. They need a fire truck. The fire truck that takes the firemen to the fire is called the LDL fire truck. So most people think that's the bad cholesterol. It is not the bad cholesterol. It's the cholesterol taking the firemen to the fire. That's really important. The HDL cholesterol takes the firemen back to the firehouse. So let's say there's a fire. Now, excuse me for a moment, but I'm going to give you my rendition of a fire truck. So when you hear, that's a fire. That's a siren. So when there's a siren, there are going to be firemen, and where are the firemen going? They're going to go to the fire. That means you have to have lots of LDL fire trucks to take the firemen to the fire. Now, cholesterol in the human body is also used to make cortisone. Cortisone I want you to think of as the water to put the fire out. But if you're eating a lot of sugar, sugars are going to require cortisone to be processed properly. So if you're busy with your hand in the cookie jar and your body is eating a lot of sugar, that means you don't have cortisone. Your body needs cortisone. So it says, brain, this is your adrenal gland, which makes the cortisone. Brain, yes, adrenal glands, I need more cortisone. So what does the brain do? It makes cholesterol first, because cholesterol goes on to become cortisone in the body. So Dr. Bob, so what exactly are you saying to me? If you are having pain in your body right now, fibromyalgia, pain anywhere in your body, and you go to your doctor, and he does a blood test to you, and your LDL is elevated, that's a body signal to me as your drugless doctor that you probably have had your hand in the cookie jar. Now, they may suggest taking a medication. I'm not telling you to or not to take the medication, but now I'm going to give you a little bit of insight. I would rather have you make appropriate and necessary lifestyle changes because the sugar could be stressing your body, and one of the reasons your LDL cholesterol is elevated. It means there's inflammation in your body, and your body has a lot of fire. That's significant. Now, what I've also learned over time is that once again, this is your liver. Your liver is located right about here in your body. You may or may not know, but the blood has to flow through your liver on the way to your heart. So your heart is here, your liver is here. Well, blood has to flow through your liver on the way to your heart. What that means to me is a drugless doctor is if your liver is compromised or not functioning optimally, the blood is going to flow into the heart a little bit more sluggish, just like on the graph right here, this EKG, where we do something in our practice called an acoustic cardiogram, where we can hear heart sounds. Well, I see patterns of distress caused by the liver, the way the blood flows through the liver on the way to your heart. So body signals for congested liver would be digestive distress with radishes or digestive distress with green pepper or cucumbers. They're not bad foods, but they're a body signal to Dr. Bob that you may have liver compromise. And then, Dr. Bob, what am I supposed to do if I want to prevent a heart attack? What I would do if I was you, eat a half a red apple every day, a third cup of beet fiber, and at least one medium carrot. That helps promote liver function. Now, let's talk about your waistlines a little bit, something called a body mass index. Ladies, you do not want a waistline greater than 35 inches. If it's greater than 35 inches, I know that you more than likely have visceral fat and your liver is compromised. Gentlemen, if your waistline is greater than 40 inches, the same thing's occurring to you because, see, your liver's enlarged. What causes your liver to be enlarged? Eating sweets, eating fried food, trans fatty acids, certain medications can cause liver compromise. So let me give you some healthy heart tips. Drink water from a pure source because water is the great purifier. Minimize the amount of sweet foods you're consuming because sugar causes inflammation. I must tell you, because I've been practicing since 1978, that is probably the hardest thing for people to minimize is sweet foods. If you crave sugar, which is not uncommon, start your day off with protein, some almonds, some cashews, some almond butter, maybe on a half an apple. That'll cut down your craving for sugar. So we need to cut back on the amount of carbs that you're consuming. Now, let's briefly talk about blood pressure. And I'm going to share with you an epidemic that I'm seeing in my practice. I am seeing individuals, especially females, 50 years old or older, that are having heart palpitations, anxiety, and high blood pressure. One of the leading causes of that, from my experience, is lack of magnesium. Magnesium is found in kale, collard greens, asparagus, green beans. Any green food is a great source of magnesium. So let me tie all this together for you. I would like you to drink water from a pure source, eat a half a red apple every day, third cup of beet fiber, one medium carrot. That's going to help take away inflammation. Minimize sugar by eating some almonds and cashews first thing in the morning so you're not craving sugar all day long. Eat green food. It'll make a huge difference. My name is Dr. Bob DeMaria. I am the Drugless Doctor. I really appreciate you watching us once again on another episode of Doctor to Doctor. I pray this will make a difference in your life. Thank you for listening. Make a few changes. I promise you, you'll be glad you did.
4, 3, 2.
Hello, my name is Dr. Bob DeMaria, and I'd like to welcome you once again to another episode of Doctor to Doctor. And today, we're going to talk to something that's very precious to each and every one of you. We're going to talk about your brain, but my concern for all of you is your memory care. When I drive around my local community today, I see establishments that have memory daycare. That means that there are individuals that are having issues through the day that they have to have their loved ones stay someplace because of memory issues. So I'm going to take a few moments, and we're going to have a test afterwards to see how much you remember, and we're going to talk about what is causing all of these issues with memory loss. Now, I've been practicing as a drugless doctor since 1978. When I first started in practice, we didn't really hear too much about dementia or Alzheimer's. And over time, as I've listened to patients and I watched family members have challenges, there's 2 or 3 areas I really want you to focus on. And number one, your brain is made up of fat, and it's made up of water. For the last 30 years, everybody's been told to stay away from fat. Well, I'm here to tell you that fat for your brain is your friend. So here's a recommendation that I'm going to make to you and that I do personally every day. Coconut oil. Now, there's a lot of controversy about coconut oil. They'll tell you that it is a saturated fat that's going to cause heart disease. Well, coconut oil comes from coconut, which is a plant. Plants don't have cholesterol in them. And actually, cholesterol, if you do some research on it after you're done watching the program today, Research coconut oil and dementia and Alzheimer's, and you'd be pleasantly surprised to learn that coconut oil, and I use at least 2 tablespoons every day, helps brain function. So what Dr. Bob does as a little secret recipe, get a rice cake, put a tablespoon of coconut oil on that, throw some almond butter on either another rice cake or just put some almond butter down first, put it in your freezer for a few minutes, let it get really cold, and you can eat it. It's going to give your brain good fat. It's going to help hormones. Now, because of practicing for such a long time period, I have learned over time that individuals in our society today have subpar adrenal gland function. You're going to say, what did you just say, Dr. Bob? Well, on top of your kidneys, there's a gland called the adrenal gland. The adrenal gland makes natural cortisone, but the adrenal gland also pushes minerals out of your body. So what I've learned from my experience because of doing mineral tissue analysis on our patients, those individuals that have adrenal gland exhaustion tend to have high aluminum. I'm going to repeat that to you. Individuals who have adrenal gland exhaustion tend to have high aluminum in their hair. How do you know if your adrenal glands are exhausted? Well, here's a simple test. Do you wear sunglasses? Do you have sunglasses in your purse or on top of your head? I don't have anything against sunglasses, but wearing sunglasses is a body signal to me that your adrenal glands, not only do they make natural cortisone, and not only do they push minerals around your body, but the adrenal glands control the size of the pupil in your eye. And if your adrenal gland is exhausted, your pupil is going to stay enlarged. So when bright light comes towards your eyes and your adrenal glands are tired, it cannot constrict that pupil. Usually you're going to crave sugar, and usually you're going to crave salt. What tires the adrenal glands is called life, stress. Learning to say I can't say yes to activities. In other words, you may have to say no sometimes. But I want you to know that sugar can stress the adrenal glands. And if your adrenal glands aren't functioning at 100%, what's going to happen to you is you're going to have higher aluminum in your body, if in fact aluminum is the main reason that you also have challenges with your memory. I also have learned over time that so many of you have inflammation in your body. What causes inflammation? Well, there's a lot of reasons to have inflammation. One is sugar. Something that we've done research on is gluten. Gluten is the protein that's found in certain grains: rye, wheat, oat, and barley. I do not have anything against those grains, but what I've seen in my practice is that we have a very simple test. It's called the Dr. Bob Squeeze the Wrist test. And you can do it right now while you're watching me. You squeeze your wrist gently. You should be able to see and feel bone. If you feel a layer of fluid, that means your body's holding on to water, your body's inflamed. And I present PowerPoint presentations all over the United States on gluten. And the reason that I do is I have found in my research is that it's very possible that gluten could be one of the issues, and people have fusion in their brain. So I'm just throwing that out to you. You may consider cutting back on your grains and focusing on foods from seed-bearing plants like it's talked about inside of the Bible. One last thought. This is an oil filter. In your body, the oil filter is actually your liver. Your liver has everything to do with fat metabolism. Remember I told you at the beginning of the program? Your brain is made up of fat and water. If your liver is compromised, you're going to have more of a challenge in processing oils. So I'm going to encourage you to eat Dr. Bob's ABCs, a half a red apple every day, a third cup of beets, that's beet fiber, and 1 medium carrot. Those 3 items, half a red apple every day, a third cup of beet fiber, and 1 medium carrot is going to help promote optimal liver function, which is going to help fat metabolism inside of your body. Why is that? Because we know that this is a printer cable. We know that your brain sends messages down the spinal cord. Well, it sends the messages on a layer of fat called the myelin sheath. The myelin sheath is made up of fat. So fat is really important. Your liver helps process the fat. So let me tie all this together for you. I would start with at least a tablespoon of coconut oil on a regular basis. Minimize sugar, because sugar is going to, by minimizing it, you're going to cut back on the inflammation in your body. I would like you to drink water from a pure source. If you crave sugar, especially in the morning, why don't you start your morning off with some protein, like some almonds or walnuts or cashews or almond butter on an apple. Those foods will keep your blood sugar low. I'm just trying to give you some tips just to keep the inflammation down in your body. By doing this, you're going to help give your adrenal glands a chance to rest. You may consider some flax oil, 1 tablespoon per pound, per 100 pounds of body weight. It'll do a lot to help make your body feel much, much better. My name is Dr. Bob DeMaria. I am the Drugless Doctor. I once again thank you for joining us on another episode of Doctor to Doctor. It is so important for us to help make a difference in your life. I would appreciate it if you just make a few changes today. I promise you, you'll be glad you did.